Welcome to Global Health Club. This slideshow is an introduction to our club and Partners in Health. Global Health Club is a club at Bainbridge High School. We also function as the Bainbridge Island Youth Partners in Health Engaged chapter. As a chapter and as a club, we educate, advocate, and fundraise for the global health organization Partners in Health. Our mission, alongside Partners in Health, is to make health a universal human right. We meet every Monday at 2 p.m. in the Commodore Meeting Room. Our logo up here with the globe is the Global Health Club logo, and our chapter logo is over here in the top right. We have two separate titles, but we function as the same group. Let's get into what this looks like. We're going to talk about our work in the past this summer, the work we're doing now, and the work we plan on doing later in the year. We're also going to introduce our officers. Global Health Club has 5 officers. Our community liaison, Maddie Brown, one of our education leads, Manu Cho. We got our other education lead, Max Kavanaugh, and we have our school liaison, Lucy King. They are going to be talking to you about the work that we've done and the work that we are planning to do. Ready? Let's go.
Hello everyone, I'm Maddie Brown and I'm the community liaison.
Woo! Yeah!
So I connect Global Health Club to the community through fundraisers and events, and also staying connected with other chapters and global health organizations. So this summer we had 2 Battle Point concession stands.
Woo!
So
Yeah!
we sold art and we also had caricatures. Manu and Max did some very talented drawings.
Oh, yeah.
All the proceeds of this event went to the Maternal Center of Excellence in Sierra Leone. So we just sold some art and then donated the money. And then we also had a yoga event where we partnered with the Diallo Yoga Center on Bainbridge. And so we all came together, did some yoga, and again, all the proceeds went to the Maternal Center of Excellence in Sierra Leone. So this, in the future, we're planning on having a big fundraiser in the fall and the spring. And we want to have a COVID-safe educational event in the fall. And then the plan for this spring right now is to have a fashion show with the title Strut in Solidarity. So how members can contribute is just helping me out with tasks, or like when we're doing fundraisers to get the word out to everyone.
Yes.
So that's me. I'm the community liaison. Thanks for listening.
Hello, I'm Manu. I'm one of the education leads for Global Health Club. Max is currently not present here. So what we do, we educate all of Global Health Club, and we just talk a lot about Partners in Health, a lot of global health issues that are happening around the world, and we try finding the roots of the issues, and then we try fighting the inequality around the world. Yeah. So in every Global Health Club meeting, we have these small education segments where Max and I will most likely just present something, and then we'll have a discussion right afterwards about the topic. Majority of the time, we're going to have supplementary readings at home where you can just learn about more information, most likely about the topic that we have at our club.
That's always optional.
Boom. So the next 3 presentations that we're going to be having in our club will be about the Maternal Center of Excellence, what makes PAH unique, and the Novavax and global COVID-19 vaccine distribution. There's some ways you can contribute to the Global Health Club segments. And one way is that you can help me and Max create an education segment for the club, or you can just make your own whole entire education segment. And but if you're new, we can definitely help you out on that and just tell you what you need, what information is most useful, and just all that stuff. That's the education lead.
Yeah.
So as school liaison, my primary responsibilities revolve around connecting Global Health Club to the broader Bainbridge High School community. To this end, I focus my efforts around student recruitment to broaden our club, and advertising among the school to again make sure that everyone in the community knows about our club, what we're doing, and can get involved if they are interested in it. I also work with the school administration to make sure that we are included in the morning announcements and on the school website and things like that. Additionally, I also run the Global Health Club Instagram page, which is featured here, and the Engage with Engagers blog, which is featured on our chapter website. In action, my responsibilities look like scheduling and making sure people know about meetings and events, primarily through intercom messages. I also make flyers and make sure that those are up around the school. When we have our club fair coming soon, you'll see us featured there, as well as on the school website. I post once a week on Instagram and once a month on the blog. I post about all sorts of things, from the books we're reading to the legislation we're advocating for and our events we're having, of course. And our blog posts are basically just a deep dive into one specific topic each post. In the future, I'm excited to continue our collaborations with other parts of the school community, most importantly, other clubs. I think that gains a really valuable perspective on the topics that we discussed, and we could also pursue fundraising partnerships and things like that could strengthen our abilities to advocate for public health. If you are interested in contributing to what I do, I would be more than happy to work with you on making a blog post or an Instagram post. Really, if you have any ideas whatsoever, if you have the time to write it yourself, that's fantastic. We in no way have to abide by the one post per month rule for the blog or the one post per week rule for the Instagram. So if you have an idea and you have a post ready, send it my way. I can totally upload it. If you have an idea and you feel like you need a little bit more help, I can also help you with that and work on formatting and getting that up as well. Otherwise, any ideas you have, any places where I can improve, please reach out. I would love to work with you.
How Global Health Club membership works. The amount of participation is up to you, but keep in mind that we are always looking for new officers because some of our officers are going to be graduating next year. We ask that all members come to meetings for the educational segments. We also offer supplementary reading material, which is optional to everybody. We also offer assignments at every meeting, and you're able to shadow officers and help them with some of the work they're doing, like we mentioned before. But all this is optional. You can, and if you can't come to every single meeting, that's also okay. We have no requirements or no participation requirements to be a part of our club. You can just be here and learn, but we offer assignments and we offer supplementary reading material if you're inspired by the work that we're doing. You can join our Google Classroom and you can show up at a meeting anytime with no prior knowledge or experience. You can show up completely confused what we're about and we'll help you through that. We just want people to join us in our effort to make health a universal human right. So we hope that you join or at least come to one meeting and see what we're about. Blessings.
Yo, what up? It's Max Dave Kavanaugh.
What's up, home slices? It's a Manu Cho.
And together we are the Education Leads of Global Health Club.
Whoop, whoop.
Yeah. So, for our first education segment, or rather our first official education segment, we'll be introducing you to Partisan Health, which is the organization we're governed beneath. We educate, advocate, and fundraise on behalf of them. So for obvious reasons, developing a pretty good foothold and understanding of them as an organization, getting to know their principles, their mission and whatnot is integral to you understanding our club as well. And we're going to start off by talking about what led to the founding of Partisan Health.
All right. So what is colonialism? Colonialism is the act of establishing control over another nation with the end goal of colonizing it with foreign settlers, capturing its resources, exploiting the labor of their people, and installing political leaders that rule in favor of the occupying nation.
Colonialism was perhaps most present in Africa. And going along with the definition, we can observe there that indigenous people were constantly removed from their homes and had their neighborhoods gentrified with the colonists.
They were also forced to perform really demanding and hard labor in conditions that were really unsuitable, and the colonizers were just dehumanizing them.
And also it disenfranchised their indigenous population, who were entirely removed from the political process and were not allowed to participate in determining their own fate as a people. Instead, the colonizers would rule in favor of themselves and rob from the people what they wanted most, which was liberation from the shackles which colonialism forced upon them.
Hey Max, why is colonialism so difficult to overcome?
I'll tell you, Manu. Colonialism, so the reason why colonialism is so difficult to overcome is largely because of the realm of discourse surrounding it and the social dynamics which pervade it. Colonialism itself thrives on ignorance and indifference and producing that within populations. In regards to ignorance, it's about cleansing the public sector and really just the public in general of any and all information they could gather on colonialism and its dastardly effects. And indifference is just capitalizing off of people being removed from those situations. Of course, in colonized countries, the people there all experience a sort of collective struggle. They can all empathize with each other. But when you are not being colonized and you are not having those shackles forced upon you, you have a lot more of a difficult time empathizing with those people and understanding their struggles, and thus wanting to do anything about it to put an end to it. And also the racial biases people had, especially against people in Africa, in a way gave reason for this exploitation and this degradation. And also the sorts of attitudes of cultural superiority did a similar thing, where you have people invading foreign countries, sending missionaries and trying to reform their cultures. And colonialism, in a lot of ways, for a lot of different people, seems like an essential step in doing that and familiarizing them with more Eurocentric values.
All right. So, but in the late 1970s, colonized nations won independence. Basically, the colonizers had to withdraw from the areas that they colonized.
Unfortunately, the absence of imperialism and colonialism did not bring with it immediate success. As given that colonialism had become such a dominating and present force in those countries and had ruled there for so long, it reclining did not immediately emancipate them. They were gone, but there was still a symbolic pressure being or weighing down upon them, and they still suffered from the effects that it had forced them into.
Yeah, and their medical infrastructure definitely took a big hit because of that. Their basic needs, such as adequate shelter, nourishment, clean water, sanitation, and just a lot more, weren't met. And because these basic needs were not met, there was a huge explosion of health issues that needed to be treated there.
So diseases spread easier, premature death rose, and this sort of widespread death led to an ever-evolving cycle of economic collapse, because you have people dying prematurely, people dying from otherwise preventable diseases, and those people dying, like these large influxes of fatality, destabilize their economies. They reduce their workforce. They make it almost impossible for people to pry themselves out of their beds, and overall it just shatters their economy completely.
Yeah, definitely. And there also wasn't enough money to pay for medical supplies that were needed to help the people.
So, as far as recovering from colonialism goes, Africa's struggles fortunately had not gone unnoticed.
Yeah, and Paul Farmer, Ophelia Dolly, Dow, Jim Young Kim, and Tom McCormack gathered beneath their shared values and founded Partners in Health. Let's go!
Okay, so getting into Partners in Health itself, we're going to talk about the mission they adhere to as. Okay, so quoting directly from their website, their mission is to provide a preferential option for the poor in healthcare by establishing long-term relationships with sister organizations based in settings of poverty. Partners in Health strives to achieve two overarching goals: to bring the benefits of modern medical science to those most in need of them, and to serve as an antidote to despair.
We draw on these resources of the world's leading medical and academic institutions and on the lived experiences of the world's poorest and sickest communities. At its root, our mission is both medical and moral. It is based on solidarity rather than charity alone. When our patients are ill and have no access to care, our teams of health professionals, scholars, and activists will do whatever it takes to make them well, just as we would do if a member of our own family or we ourselves were ill.
So one thing which distinguishes Partners in Health as an organization is that they're trying to find permanent solutions rather than temporary ones. Of course, most organizations that posture themselves as charitable and philanthropic do intend, or rather pretend to be wanting to find permanent solutions. But really, their permanent solutions just involve funneling money to the people rather than trying to amend the structural problems that are fundamental to their suffering and are inextricable from their suffering as well.
Yeah, and we also have to prioritize those who need care the most. Yeah.
It also offers a complete model of care, which doesn't just involve physical health, but also involves enriching people's mental health, their social health, as well as their emotional health too.
It also doesn't squander its patients' lives with cheap medicines. Of course, in order to permanently help them, we can't, get any cheap medical supplies. We need to get the best for people who are in need, and the best will definitely help them better than just getting some like garbage supplies that will probably only help them a tiny bit.
And we shouldn't in the first place. Often we have this attitude that poor people are less deserving of high quality medicines, when in reality, everyone is deserving of the exact same standard. But getting into a little quote here, it's from Paul Farmer, who we mentioned earlier, being one of the founders of Partisan Health. It's just one of the fundamental principles to the organization. We refuse to accept that any life is worth less than another. So, getting into what their principles are. Partisan Health governs itself on behalf of a shared and universal set of beliefs, all echoing their continued and ever-passionate dedication to the principles of social justice. And these beliefs are as follows.
All human lives have the same value and bear the inalienable right to health to fulfill their potential.
All fundamental human rights are interrelated and just as inalienable as one another.
All people need to band together with those who find themselves living in the most marginalized sections of the world to generate meaningful change.
The playing field must be leveled for individuals who are born at a disadvantage so they too can prosper.
Injustice is not accidental, but a direct result of structural violence and oppression, and that injustice can be fought through altering those structures.
And finally, we have a moral obligation to expose social injustice and to rid ourselves of the structural forces that create inequalities, no matter how impossible or challenging that goal might appear.
Yeah, and these beliefs are extremely important. Human rights are the foundation to our freedom and protection, and they're the standards that protect the dignity of all human beings.
And these rights are also fundamental in guaranteeing that all people, not just a select few born into relative wealth, are capable of living out comfortable, fulfilling, and peaceful lives.
Yeah, and meaningful progress must arise from collective action. So working together with others is extremely important to helping out not only the community, but the future generations.
How does PH operate? So, another thing that distinguishes Partisan Health as an organization is that they address necessities of care that most often go ignored. Not just in terms of these sorts of philanthropic organizations, whatever you like to call them, but also in most hospitals around the world and most countries' medical infrastructure. So, although we can all agree that having well-trained staff, having well-built hospitals that are capable of housing entire communities, and having and maintaining a reliable flow of medication and other medical supplies is vital in creating a dependable health system. It doesn't quite go the full 9 yards, or doesn't quite go far enough to the point where you can actually generate a fully dependable healthcare system, or one that can serve people to the best of its extent.
Yes, and Partisan Health believes that the best way to help those who are in need is by collaborating with the communities, and the importance of communal collaboration cannot be overstated. Knowing what the problem is by talking with communities is extremely important to fixing the problem.
Yeah, and it's important to note that members of the communities are far better equipped to determine their level of care, as well as the care they should be receiving, than the doctors involved in Partisan Health are. And oftentimes, having an absence of communication between communities and organizations can breed hierarchies where the needs, wants, judgments, and values of the organization displace the needs, wants, and desires of the people themselves, which ultimately, drastically lessens the quality of the care that they're receiving.
Yes. And we also need to embrace mutual aid, which is a form of management which embraces collective, democratic, and self-governance, which basically means that citizens are able to participate and help their community.
Partisan Health also enlists a workforce of community health workers who are trusted and valued members of given communities that go around and ensure people are receiving the best the best care possible, are taking their medication, things like that. They are essentially the fulcrum bridging the gap between communities and the community and the organization.
Yes, and basically to repeat what we said earlier, collaborating with communities is the most viable way to pursuing our goals.
All right. So this is the list of PH's 5 S's, which are the underlying necessities of care which underpin its services, and these are as follows.
Staff, which is the well-trained, qualified staff in sufficient quantity to respond to need.
Stuff, ensuring our tools and resources needed for care delivery and administration.
Space, safe, appropriate spaces with capacity to serve patients.
Systems, leadership and governance, information, financing.
And finally, social support, which is providing basic necessities and resources needed to ensure effective care.
And to close out our segment, we'll be going over some of PH's accomplishments. So as far as their impacts on mental health goes, in Liberia, there's been a 30% increase in patients enrolled in mental health care. There are 102 facilities providing mental health care in 10 countries. And there are more than 9,500 people receiving mental health care, with more than 55,000 visits each year.
Yeah, and some impacts on child health is that more than 70,000 kilograms of nutrient-rich peanut paste was produced each year to treat malnourished children in Haiti, and more than 18,350 children were treated for malnutrition each year at PAH supported facilities.
As far as their impacts on HIV and AIDS, 92% of people living with HIV are on antiretrovirals in Nina, Malawi. There are more than 12,000 patients living with HIV who receive care at PAH supported facilities in Haiti, and there's a 99.9% monthly average rate of HIV patients returning for ongoing care in Sierra Leone.
Yeah, and so impacts on maternal health are that 58,000, safe facility-based deliveries happened, including 10,000 life-saving C-sections globally each year. There was more than 134,000 prenatal care visits provided annually, and PIH support more than 50,000 women in starting a family planning method each year, and they also built the Maternal Center of Excellence in Sierra Leone.
So last year, PH provided 2.8 million outpatient visits in our clinics, 2 million women's health checkups around the world, and over 2.1 million home visits conducted by community health workers. Okay, so we're also going to talk and but we're going to be a little bit more specific and talk about Haiti. And Haiti is significant to Partisan Health for a variety of reasons. It is, in a lot of ways, what catalyzed Partisan Health's creation in the first place. But also Haiti is just one of the most economically disadvantaged countries in the world, and one of the most violently exploited ones as well. So to see the kind of success that we have, or the Partisan Health has been able to effectuate in Haiti, is remarkable. But going over some of the challenges that Haiti faced, one of them was political disruption, as we talked earlier about disenfranchisement and people being having their voice, or indigenous citizens rather, having their voices removed from the political process, installing new leaders that were meant to reinforce Western values and displace their own.
There's also an absence of economic development. Because they were exploited, they had trouble just developing their country as a whole.
There was also frequent natural disasters.
There was also post-colonial exploitation. As we said earlier, colonialism had a huge effect in Africa, and especially in Haiti.
Yeah, and it's also important to know, just a quick aside, most countries which had at one point been colonized continued to face some degree of resource capture and financial exploitation even after colonialism had reclined in their countries. So, because they were, left in incredibly vulnerable positions. And they also struggled to maintain their public systems.
And finally, they couldn't meet their people's health-related needs.
So, going over PH's impacts in Haiti, they employ more than 6,300 staff, 2,500 of which are community health workers.
They provide primary care, maternal and child health care, HIV and tuberculosis services, and more advanced secondary and tertiary care.
Tertiary.
my
98%
bad.
of graduates from the medical residency program stay to work in Haiti.
And each day, 95% of women in Journey to 9+ programs have facility-based deliveries versus a 36% nationwide.
And that is the end of our presentation on Partisan Health. We hope you enjoyed it. Meet at the Wagon Wheel at 1:50, aka immediately after school on Monday. And yet again, we are your education leads, Max David Kavanaugh.
And my new show, baby.
It's Max David Kavanaugh.
It is my new show, baby.
Okay, that's it. Bye.
Universal right to health!